Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Fara Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Hi, welcome back to the Future of Dermatology podcast. Today we are so excited. We're joined by Whitney Tolpinrud, who is one of the most fantastic dermatologists that I know. She is currently the medical director at Curology and agency, which is no easy feat. They have treated over 5 million patients on telehealth. So I'm so excited to hear about what she's doing there from a day-to-day standpoint. But before we start, we'll just kind of go over a little bit about what brought Whitney to where she is now. And of course, I've known Whitney for a long time now. We both started, I think maybe 7 or 8 years ago. Whitney was at Palo Alto Medical Foundation. I think the two of us started at the same time because we took over for two derms who were retiring at the same time. So we met there. And I remember like the first day meeting Whitney, this like supermodel just walks in to the clinic and just I think it maybe started a little bit before me actually, and you were just like running this like super smooth practice. That was my first job out of residency, so I was kind of like, oh my god, what am I doing? And I just seen Whitney just like nailing it and just had life down. And I think one of the other docs gave us a thing that said Babe Cave at the time for our
Yes, Babe
office,
Cave. I remember that.
and then we started having a bunch of babies after that, and then we switched it to Baby Cave.
That's
But
so
thank you
fitting.
so much for joining, Whitney. It's so fun to have you here. And yeah, if you want to start anywhere along that journey of kind of what's led you to where you are now.
Sure. I just can't believe, how fast clinical practice goes by and time goes by. So it's such a pleasure to see you and to chat with you and talk about our journeys. So thanks for inviting me on your amazing podcast. Really appreciate it. So yes, I'm Whitney Tolpinrud, and I'm a board certified dermatologist. Fara and I have known each other for quite a while now. I went to medical school at Yale back in the day, did my internship in internal medicine at Brigham and Women's, and then my dermatology residency at Columbia in New York. And now I'm set up shop here in San Diego with my family. So I've just been kind of thinking about over the last couple of days this journey to get here, and I really can't believe how fast it goes. Um, so I did clinical practice for about 5 years. Practiced in New York and Manhattan on the Upper East Side, and then practiced in Palo Alto with you, Farah. And then my husband's an orthopedic surgeon, and we moved to San Diego, where he is currently practicing, and we now live with our babies. And I joined another clinical practice here in San Diego. All three practices have been in private practice, and then PAMF. And What happened was at in San Diego, I love, I've always loved patient care, right? Patient care is so amazing. We see 30 to 40 patients per day. Um, Patients are fantastic. They have inquisitive questions. It's so amazing to walk into a patient exam room and look at them and diagnose them, give them a treatment, and then help them. And it's really satisfying work, especially not just the medical side, but the surgical side. And of course, the cosmetics always add such a nice dynamic to clinical practice. But the reality is, we're only able to see 30 to 40 patients a day. I mean, it seems like a lot personally, but when you think about the grand scheme of life and how many patients there are, and how many dermatology deserts there are, that's a really inefficient way to see patients. And I always, in the back of my mind, seeing patients, was thinking, gosh, how can this? There's got to be a better way. There's got to be a more efficient way to scale this, to help more people, to use our expertise to really help a larger number of patients. And so I think that's what really drove me to seek an alternative career outside of just straight clinical practice. And Curology is an amazing company based in San Diego, and we're a personalized skincare service. We're a telemedicine brand. where we offer direct-to-consumer prescription compounded medications. And we see patients on our telemedicine platform. We have an in-house team of medical providers, but we also have cosmetic and OTC skincare products to help supplement that routine. And I kept seeing in my clinical practice patients bringing in bottles of Curology prescriptions, and I looked at the ingredients and I thought, wow, this is actually a really solid combination of ingredients and percentages that I would recommend to my patients. So it turns out that one of my colleagues that I had worked with at my private practice in San Diego actually worked part-time for Curology. And so that's how I was first introduced to the company. And I joined as a part-time dermatologist 1 day a week. Now that was February of 2020 when I joined. And right when, a few weeks later, COVID started to take off. So telemedicine at that point, we know it was already starting to become very popular, but because of COVID, really the telemedicine platforms started to become very convenient and necessary for a lot of patients, especially in our own clinical practices. And so I was doing both clinical practice and Curology, and then transitioned over to the associate medical director position as that opportunity arose, and then became the medical director a couple of years ago, and have continued to just learn and grow and contribute as much as I can to our patients and our company. It's been such an amazing ride.
Oh my gosh. That's incredible, Whitney. I'm sure there's probably so much more details in there.
It seems so easy.
Yeah, oh, just a few. And I think the amazing thing is because I've worked with you like day in and day out in clinical medicine, and I've worked with a lot of other dermatologists too, of course, over my lifetime and residency, and you just get to see so many different practices. And I think you are just an impeccable dermatologist. Like your patients loved you. I remember when you moved from Palo Alto to San Diego, some of them were like, well, maybe I could go to San Diego and see her.
That was very sweet. I appreciate
Yeah,
that.
so it's kind of amazing. It's true because when you have really kind of perfected the practice of medicine, seeing 30 to 40 patients a day, I think there's just that part of you where sort of like, well, what can you do next, the next level? Like how many more patients can you see? How many more lives can you touch? So that's actually incredible that telehealth allows that. And then that's crazy that you guys were like, you started it right before COVID hit. Because I think the rest of the country was trying to figure out telehealth, but you're like at a place where it had like mastered it. Right? Like
Yeah,
Curology was one of the first groups, right, that was kind of doing this type of work.
right, which is really what inspired me, pre-COVID. I joined before COVID had even hit,
Yeah.
but it really inspired me to join something new and innovative. And it was a tech startup at that point. So it was something very different than the skill set that I had already developed in patient care. And I think as clinicians and physicians and dermatologists, we have that hunger for knowledge and growth, and I don't think that ever really goes away. And so Curology just gave me a platform in which to continue to learn and grow and help more people.
Yeah, no, it's fantastic. And I think I learned more about it through you as well. I've always
Mhm.
kind of been in health tech, so I love just
Yeah.
hearing health tech solutions. But I know that there's probably for the majority of docs, it's a shift in mindset, I think. And then COVID kind of forced us all to do it. I feel like there was like a few docs who were doing some level of telehealth like throughout the last 10, 15 years or more, whether it was like in academic centers or not, like the one guy that did a little bit of telehealth versus classes like this. And then now everyone is sort of looking into it and sees the value in it, which is really, really cool. But seeing also just the way that I don't know if you want to speak at all about how sort of Curology was started, but kind of hearing the story from you is really cool about how, because it was dermatology started, right? It was basically,
Yes. Yeah, I think about 10 years ago or so, maybe a little bit more, David Lorcher, he is a dermatologist. So our company is derm founded, developed, tested. So we're sort of, dermatologists are at the center of the company. And he practiced in New Mexico and realized that patients would drive hours and hours and hours to see him to get treated for acne. And he thought, goodness, driving all that way for acne when I could have just potentially done a telemedicine visit or like a phone visit to explain how to use the treatment services. And he also realized, goodness, he'd give a prescription and then the patient would use it for a few days of tretinoin. Patient would use it and then their skin would get all irritated and dry, and then they would just drop off. They would stop using it. And they lived so far away and they didn't have that tight connection, the ability to just reach back out and ask, hey, what do I do in this scenario? Or the patients felt that way. So he thought, gosh, there's got to be a better way to see the specific type of patient for acne, kind of low acuity. Of course, telemedicine, you can't treat all of dermatology through a telemedicine platform. You really have to be very selective on the conditions that you're going to treat and see. And acne is one of those that we feel very comfortable treating through a telemedicine platform. So he thought there's got to be a better way to do this, and decided to develop this telemedicine platform specifically for these patients in these dermatology deserts that had to drive hours and hours, and then to be able to do custom compounding where you can include multiple different prescriptions into one bottle, because of course by the time his patients would pay for multiple different prescriptions that he had written for, it was oftentimes cost prohibitive, where they weren't able to actually pay for all three. So they would choose one prescription and try to use it and then stop using it because it was irritating. So he thought, gosh, if I can combine all these ingredients into one formula, and then start off at a lower percentage of tretinoin, for example, and then slowly ramp up using micro jumps, he thought he could really help these patients. And he was right. It's been really incredible to be able to treat patients in dermatology deserts where they just don't have direct access to high quality dermatologists.
Yeah, no, that story is incredible. And I think it's just really something that maybe only like a dermatologist can make those connections, because you're seeing it every day. I think for me now, practicing in Palo Alto, you kind of forget, because there's so much access, like there's so many dermatologists around us, you kind of forget that access piece. It's not that the same thing in the rest of the country. And even for us, there's still super long wait times. Patients might not want to come back just because it's hard to do that whole thing. But the other piece of it, though, even though we're in Palo Alto, we have all the access, the medication piece is getting so much crazier, like every year. I can't get anything approved for patients anymore. And then I feel really bad because we have this like full conversation. And then I'm like, I'm going to send you this and this and this is how you're going to use it. And then like an hour later, they're like, oh, it's rejected. Okay, so I'm going to send you some benzocaine now. So it's really just like we do have, and I think I still in my clinic, like if I give Accutane, that's a slam dunk. Or like lasers for acne, those are kind of slam dunk treatments, which I think, like you say, those certain things just have to be done in person. So those are like slam dunks. Topicals are very, like, they're not super rewarding in clinical practice. There are certain people who will take your tretinoin, follow directions really carefully, get through that period of a little bit of like breakout, dryness, all of that, and they'll do great. But I think that's the minority, especially in teenagers and young people. And then so you try to give all these other medicines, then they're not covered. It's a whole thing. So I think this is genius. I think just doing the compounded medicines. I gotta admit too, at first my dermatology brain, like my dermatology trained brain didn't really understand the lower strengths of tret. But when you think about it, I think one of the things you explained to me over time is, of course, it's combined. So we have to treat it differently. It's not just us writing straight tretinoin. It's really you're combining different ingredients. So you have to be conscious not to overdo any of them because they're being applied at the same time, which has kind of changed my practice too in a way, just that mind shift even in practice, because even though I might be prescribing 3 different things, they might be putting it on at the same time too.
So I think about that, right?
And I'm giving like a bunch of benzoyl peroxide, you're probably not going to be super happy. Like not a lot of people's skin can tolerate that, except for maybe they're super like sebaceous and might be fine with it. So that's been kind of a really cool thing that I think you guys have like perfected, that I've kind of taken away, is you can go lower strengths and get results, and they're more comfortable. They'll probably do it longer. And then just the access piece too. It's really just that access piece. Like they're not going a million times to the pharmacy. It's really annoying to have. I had a patient one time, she's like 17. I was like, okay, if this doesn't work, you take this coupon card. And she's like, well, why, if there's a coupon card, why don't they just make it that price? I'm like, I don't know the answer to that. There's some convoluted thing that goes on with the pharmacy benefit managers, and like, I don't even know. It's really, really hard. So that is a major problem. I think that it's solved. It's really like, here you go. It's going to be this price. It's coming to your house. But I think a lot of dermatology probably will go that way. And of course, this is sort of our future of dermatology podcast. So we like to kind of try to forecast where dermatology is going in like the next 5 to 10 years. I think a lot of it, especially with topicals, is going to be going this way.
The nice thing is, so with the Tret piece, yeah, we do start off low, but ideally you ramp it. So they're not just stuck on a low percentage, like you keep ramping it up. So that's ideal. So I think that's the future too, is more personalization for patients, and really being able to select ingredients that are really going to help move the needle for our patients. And using ingredients that are a little bit more challenging to prescribe, given like it's either cost prohibitive or it's not available in certain areas of the country. So ivermectin, for example, we can put ivermectin in some of our formulas for rosacea formulas, topical tranexamic acid. We have a sulfacetamide cleanser with other ingredients in it as well. So just being able to have access to different, more unusual or less common actives.
Oh my gosh, yeah. You have no idea how many Soolantra prior authorizations we
have. Oh, I remember.
Are we still here? Are we still at this stage? And then also just the tech piece is something we really can't emulate in private practice. I mean, like in clinical practice, because I feel like we sort of do things that are recognized with insurance codes, but then we can't really do these like cool check-ins and just tell us how you're doing. And like, I've seen your system like the thumbs up and thumbs up, just simple things like that. And if it's a thumbs down, hey, let's talk about why. That is. Whereas in clinical medicine, you're right. You hand the prescription. You're like, well, I'll see you maybe in 6 to 8 weeks.
Yeah. I mean, generally our patients typically only in private practice or in person would reach out when there's a big problem, not when there's, small issues. So the nice thing about the tech-enabled platform is it allows patients to have higher touch points with medical providers, so that way there's closer communication. Whereas in private practice, you may not, you may not need that high level of touch points with. They got a little bit of dryness. It's not a huge issue. It's okay. So the tech platform does allow for, I think, a better patient experience, and allows for a little more, hand holding, if you will.
No, it's super cool. And then, so what is like? So I know the clinical practice life, and we've lived that life together. What is like your day like now? Like, what is a day like in the life?
That's such a great question.
Medical director, and it's probably different every day, but you can give multiple scenarios.
So for me, every day is very different. I'm involved in many different aspects of the company. Being the medical director, I'm the only full-time dermatologist here at the company. And again, we treated more than 5 million patients. So it's a really big group, a very big company. And I'm involved, of course, with product development, whether that be from a prescription standpoint, or an over-the-counter or cosmetic perspective. So we have a full spectrum of skincare products. So I'm involved with the development of all those. Also from a marketing perspective, I do a lot of marketing reviews. I filmed a commercial a few weeks ago.
Can you send us that? Can we link it to
hair loss arm? So that'll be really fun.
Send us that when you have it. We have to link it to it.
It was a blast. And I review, a ton of marketing content that goes out, whether that be from influencers to ads to our social media platforms. I just review the medical integrity of a lot of content that goes out, not to mention our patient-facing information. So I always want to make sure that's accurate from a medical perspective. I answer a lot of questions from magazines and journals, as you know. So do a lot of marketing. And then from a tech perspective, I'm involved very closely with that regarding our sign-up flow, our check-ins, our tech-enabled platform. We want to make sure that's seamlessly integrated into our medical practice. Of course, I run our medical protocols, our clinical patient care team. We want to make sure our standard of medical care is very high. So I do all of our medical protocols. I still do I dabble in patient care when needed. I am also involved with our clinical research team. So we've completed a clinical trial that was IRB approved. It was really amazing. So I was the PI for that.
Is
Yeah,
it too
so
early
every
to talk
day is
about? Is
very
it too
different.
early to talk about what the trial was and results?
No, sure. It was actually it was a couple of years ago that we did it. So we were looking at the Curology's personalized system, so the whole system altogether, and how we treat patients from start to end with mild and moderate acne. So we chose those patients to start with, and it was prospective, observational, evaluator blind, and of course it was remote. And again, we looked at the personalized system for Curology for mild and moderate acne. And then what we were trying to do was look at two endpoints. Number one, the clinical outcomes, and then number two, the user perceptions. And the primary endpoint was number one, clinically observed response to treatment using, of course, the photos that the participants would submit to us through our telemedicine platform. And we looked at patients at baseline, 3 weeks, 6 weeks, 8 weeks, and 12 weeks. And then we used independent evaluators, so outside dermatologists. We used 3 external dermatologists to grade the acneiform lesions. We used the investigator's global assessment, so the IGA scale. And then on the secondary endpoint, we wanted to understand how the patients perceived their treatment and their progress. So we looked at their perception of treatment results and also how easy it was to use the system. And then we looked at patient compliance with the treatment regimen. And then we looked at tolerability and how patients assess the evenness of their skin texture and tone. And we were able to find that patients, around 90% of them thought that our treatment worked for them. So that was a pretty exciting.
That's a pretty good number. Yeah.
Yeah, 90%
Happy.
improvement for that was the patient perception piece.
That's fantastic, Whitney, because basically I think our derm brains just recognize data, and that's just how we've been trained, which is probably what, in some ways, I find when we're just kind of doing our clinical grind, we're just all kind of practicing the same way because we've all just kind of been trained that way. And then it's so cool when somebody just like goes out, has a thought, like an innovative thought, and does it, but then comes back and is like, well, look, it did work, and look at a systematic.
Yeah,
And of course, we know it's working because over 5 million people keep coming back.
Oh, absolutely. I mean, that's the big testament here is people keep coming back, and we just see amazing clinical response rates from our patients. And of course, not only do we give topicals, but we also can give oral medications too if patients need it. Not Accutane, of course, but if they need a short course of doxycycline or even prednisone for those really inflamed patients, then we can help them with that.
That's fantastic. Do you guys have other trials coming up? Are you looking at any specific formulations or anything like that?
We have our ideas and our running list of clinical trial questions that we
You'll
would
have
love
to keep
to
us
answer.
posted anytime another one comes up.
Yeah, I will. I totally will. It's been really fun.
We love data on this channel.
Oh, okay. Yes, that's good to know. We all love data.
Oh my God, like so excited over this poster. Can't wait to see it. So you guys are going to be at the AED too. That's amazing.
Yeah, so I'll be there, and of course we have a team of dermatologists that are
in
working.
San Diego this year, so of course it's like it's right in your backyard.
Exactly.
Oh, that's so great. And then anything else about the tech piece? And I guess I'm just curious, like, because we have our medical training, like how steep was learning curve? Kind of jumping into a position like this, because there's probably so many hats that you have to wear in like a company like this where they're doing so many things.
Yeah, that's a great question. I mean, it certainly took time for me to dive in, but I think the biggest, I think everybody just stands in their own way, right? Like you are, as a dermatologist, as a physician, you are bright, you are smart. You want to just kind of get out of your own way and go for it. Don't stand in your own way, because I think that is the biggest hindrance. You're fully capable of learning anything, and learning the content that we've learned, I think is testament to that. So that's my first piece of advice. And if I could just add one more kind of important story in my life that I think helped set me up for this, that would be, do we have the time?
Absolutely, yes.
That'd be great. So another thing I wanted to share with your listeners here, our colleagues, is that out of residency, I felt like I needed to do something else with my medical education to really reach more people. And so I reached out to the Chickasaw Nation, which is a Native American tribe in Oklahoma, because my grandmother was Chickasaw. And I thought, goodness, that would be a really great way to start spreading my knowledge to help set up a clinic there. And I called the clinics, I called primary care physicians there to try to make a connection to start it. And no one ever called me back. And I thought, I could have just given up, right? Like that could have been it and moved on. I mean, I probably sent out maybe 4 emails and called and left a bunch of, maybe like 5 messages for people, and no one ever returned my call, despite me trying to like weasel my way in, and of course I
such great work. You would think they'd be like on top of that, like, yes, let's do
well, I get it. They didn't know who I was and sort of what I wanted, but I decided, okay, I'm going to make this happen no matter what. So
Wow.
I called the hospital, the Chickasaw Nation Medical Center has a really big hospital there in Ada, Oklahoma. And I called the information line and left a message for the chief medical officer and with the receptionist. And she was like, well, who are you? And I was like, explained who I was and I wanted to start a derm clinic. And he called me back later that evening. And so I graduated residency in July, and I think I had this conversation with him in August. By November, I started a clinic by just sheer persistence and like not stopping, and just, okay, I'm going to make this happen no matter what. And I'm going to keep opening up doors and windows until this happens. And I'm going to keep reaching out to people until a door opens. And so I think that's a piece of this too, is just never giving up. And when you know that you want something, just don't take no for an answer. Keep going, keep looking.
Oh my
And
gosh.
yeah, you just gotta keep going.
Just keep going. If you have a goal in mind. How is that clinic doing? I remember when you were a PAMP, you were still like really involved.
Yeah, I was just there last month, and I'm going here and
Oh my gosh,
in
still
at the
going
end of
strong.
January. Yeah, so still strong. We have a full clinic up and running. I've got staff there who are fully trained. We have pathologists, dermatopathologists who read slides. It's a full clinic. We see the full spectrum. We have patients on biologics, Accutane.
Incredible.
Yeah, it's a full clinic up and running, so it's still going. We help thousands of patients. It's been really incredible. But that really taught me, like, you just keep going, and if people tell you no, you keep going.
That's such an important point, because I think we have such an amazing skill set as dermatologists, but for some reason I think whatever way the training is, in some ways I think the training has to force you to kind of keep getting in line, like as a med student, as a resident.
Right.
And that's a good thing, because you kind of do, and you have to follow protocols, because it's, maybe you're in the ICU in the middle of the night and you have to follow the protocols, and there's times when that's necessary. But then maybe it beats that bit of, like, I don't even know what the perfect word for it is, but that's just that energy you have when you're a little bit younger and you're like, I'm going to go to med school, I can do it. So you have that kind of drive in you, but at some point that gets curved a little bit. And of course you have all these layers of, sure, the ethics and this and this and this on top of it that just kind of weigh you down. You're like, well, if I do this and this, so it's a lot that happens, to the point where I do find a lot of people out of the training, there is just this hesitance you build. There's like this fear or hesitance. Like there was another episode we talked to one of our colleagues about, she just started private practice. And that, like, something like that is like there's so much hesitance around it. Right? Whereas in the 80s, everybody just did that. They just left residency and they went and just opened up shop. They succeeded. They're physicians. People need to see dermatologists. Things work out. But now, because of all the complexity and everything else, there's like this crazy fear. So I don't know if there's a little bit of difference in how medical training is now too, versus the way maybe it was in the 80s. Because there's a little bit of the complexity of the system, but it's still not an impossible system, right? You see lots of people in private practice doing it. And so I think there's this added layer of this like hesitation of fear that we all have. So I don't know where it exactly comes from, but I do feel like everyone's just kind of
like you say, just needs to get out of their own head. Whatever way we've kind of converged here, where any thought you had, you're like, but should I? Like, of course you should. You're a board certified dermatologist. Of course you could do it.
Absolutely. And, the reality is there's no roadmap. No one is going to give you the answers to get to where you want to go. And I think that's what a lot of us are looking for is, okay, there's, you graduate medical school, you do internship, you go to residency, then you pass your boards and you start seeing patients. There's this roadmap set out for us, and then you hit these hurdles, and then you're released into the wild and see patients. But it's this nice, safe road to go to accomplish the goals that you need to be able to practice clinical medicine. And the reality is, there's not that if you want to expand into other avenues like tech, like entrepreneurship, like C-suite, for example. So. I think don't wait for someone to say you can do it. Here's the roadmap, because that probably will never come.
It'll just it won't happen. No, that's so inspiring. I love those things. I can't wait to get those links, and we'll put them at the bottom of this. And then we always ask all our guests, because it's the Future of Dermatology podcast, what you kind of foresee in the future of dermatology, if anything. Like what things do you, you guys are really at the forefront of the future, but what things you might see kind of coming up, and what trends might be coming up?
Of course, I think medicine will be more personalized, as it's already starting to become more personalized, but probably using even more like individual biodata and genetics to be able to determine what treatments may work best for certain patients. And then, of course, implementing technology into practices. Fara, you and I have had many conversations about AI and how technology can better help our patients and our practice. So I think AI will be at the forefront of medical practice in the future. So I think those are the two biggies that I see in my mind as the future of medicine.
Yeah, absolutely. I agree. I think those things are here to stay. So we had I was giving a talk to the UCSF residents about like healthcare, how it's like healthcare 1.0 to 5.0, where now the tech is 5.0, where AI is. Healthcare 1.0 being like paper charts. Yeah. There's still offices that have paper charts, right? And it's
I was out of practice where I was still using paper charts, so it was not too long ago for me.
Like a super productive practice too. They weren't necessarily against technology, but that was the easier way to go. And I always joke, like those doctors, they probably all have iPhones. Like they're not on a flip phone or one of those like 80s, like car phones or anything. So they're not opposed to technology. It's just the technology kind of has to be good, and it has to serve them really well too. So I think companies like yours, that you guys are, the fact that it was started by dermatologists and dermatologists are shaping it is also so amazing. I hope that's some of the future too, where it's actually the physicians making the changes, because then the technology is going to be something that helps you. Absolutely. It's not going to be just like one of those, all the other technology that's kind of been handed to us that everyone's kind of opposed to. It was like developed by non-physicians, and
I think that's essential. The physicians and the dermatologists have to be at the forefront of developing the technology, so that way it helps. And it doesn't hurt. You don't want it to.
Why you guys are with over 5 million patients is dermatologists just know patient care and are good at it. And are doing
we have very high standards. If we didn't, I wouldn't be at the company.
Right, exactly.
Essential.
I think that's the thing. It's like, I think it's because there was actually an article that I commented on. They asked about, well, there's so many telehealth platforms, and what should patients look for? And I think that's probably the number one thing. Look for dermatologists to be leading it, because then you're getting excellent care, and it's trickling down. Like they're setting the mode for everyone else that's working at the company. As opposed to like somebody talked to a dermatologist at some point when this company was started.
Yeah, I agree. I think that's
so fantastic.
Something that's an added value, absolutely, because the information that's coming from the company and all the product development. Who's at the heart of it, guiding the decisions. So I totally agree.
Sounds good. Well, thank you so much, Whitney.
Of course. Thanks, Fara. It's so great to see you. Nice chatting with you.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.